comprehensive primary care CPC initiative worked to improve care, improve health, and lower costs for patients and their families in the primary care setting. Nearly 500 primary care practices and more than 2,000 practitioners were enrolled in CPC from 2012 to 2016. The CPC initiative focused on 5 functions of primary care: access and continuity, planned care and population health, risk-stratified care management, patient and caregiver engagement, and coordination of care across a medical neighborhood. This on-demand learning series explores how CPC practices implemented strategies designed to strengthen primary care.
I'm with Family Medical Group Northeast in Portland, Oregon. We're an independent clinic. We have 6 providers. We have about 7,700 active patients. But one of the other components we looked at in the clinic is that we see a lot of low back pain. And generally our patients would come in and they really wanted the MRI to see exactly what was going on with that back that was causing the problem. And we would often find that that would get ordered and there wasn't any real reason for the MRI. And so we identified that as kind of an area of wasted healthcare dollars, and we felt that we really needed to do a better job of working with our patients and communicating with them and sharing some of that decision making so that they could see what the cost of care was if they went out for an MRI. And so we implemented a low back pain decision aid. We went out and kind of looked at what was out there and really didn't like what was there, so we took some pieces of the ones we did like and kind of crafted our own. We put in the costs for MRI and the costs for some of the other treatment pieces, and then we put in some information such as the percentage of patients that, even though they had the MRI, still would experience pain for the same amount of time as somebody that didn't have the MRI in most cases. And so we were trying to use that as kind of a patient education piece so that when the provider actually went into the room and was talking to the patient would be alerted a little bit and share in that decision that, gee, maybe I don't want to spend all those dollars right now on an MRI. Let me see what I can do, and then if that doesn't work, come back and work on the next phase of that. So really, we tried that for a couple of quarters. At the end of December, I happened to ask one of the physicians in the hallway, I said, so we've done 2 really good quarters of rolling out that shared decision-making tool. How have you felt? Have you seen any change in behaviors, any reduction in MRIs? And the provider looked at me and goes, nope, haven't seen a thing. He says, I'm still ordering as many MRIs as I did before. I'm just doing more work now. A couple of weeks earlier, I had been outside that same provider's exam room when he came out and he said to his medical assistant, I need to get some prices on x-rays. My patient, instead of doing the MRI, wants to know if he had x-rays done at this place, how much they would be. I was doing a happy dance that day. I was so excited. But we heard from the providers that they really didn't see any decrease in cost. And so we showed them the data. And we did have a decrease in the percentage of MRIs that patients were receiving. So of those patients that got the tool, there was a decrease in MRIs ordered. And we also saw an uptick in patients being more involved in the decision-making process and being more of a partner in deciding what treatment option they're going to have. So here's a snapshot of the data for quarter 3 and quarter 4, and you can see that out of all the patients that received the tool, only 7% got MRIs. In fact, the provider that told me he didn't see any change whatsoever by using the shared decision-making tool didn't order any MRI in quarter 4. We thought that this was great because sometimes when you're in the midst of doing all this change and trying to do the right things, it doesn't feel like you're making progress, but when you run the numbers and you show the providers, it is making a difference. We are reducing unnecessary costs of MRI. It helps them understand that, yes, it is the right thing to involve the patient, and it is the right thing to give them more information about costs and about outcomes. And so we're really pleased with this component. So lessons learned, probably the biggest lesson learned is making that connection with the patient, and that helps them set their goals and it helps them be successful in working towards their goal. And from my standpoint, using an Excel spreadsheet or a registry to record the data really helped us guide where we were going to focus as we move forward. In the beginning, we were using anecdotal information to select things we were working on. Now we actually know, okay, we have an opportunity here. And I would say to anybody out there, what we've learned over the past 3 years is try some things. Not all of them will work, but our patients have been so understanding and so supportive, and it's allowed us to start a process of change with our patients and have them more empowered.
For more information and resources, visit the Comprehensive Primary Care Initiative webpage. Go to innovation.cms.gov and search for the CPC Innovation Model. This has been a production of TMF Health Quality Institute.